why should we all care so much about this, right? How is it going to impact each of our day to day, each of our jobs? What should we be expecting to see changes in our lifestyle and daily interaction? So that can be, as interpreted as broad or specific as you'd like. But Ben, we'll start with you.
I think that in terms of why we should all care about AI and machine learning, I liken it to the internet, right? It sounds very simple, but it's sort of like thinking about, back in the day, people would say, I don't really believe in this internet thing. I'm going to, keep going to the library, keep using the encyclopedia. And AI is really something similar, where AI, I believe, is going to make our lives so much easier. It's going to improve the ways that we work and better our workflow. And so if you're a leader in an organization, or even if you're not, it's important to start to learn about AI so that you can figure out how to incorporate it into your workflow. And basically to think about what's coming down the pipeline. I think that AI, machine learning, is not a fad. It's really something that's here to stay. And so how can you better understand what's coming down the line?
Love it. Derek, you have anything to add to that?
Yeah, I love Ben's analogy here. I have a little kid inside of me, and I liken it more to superpowers. I think AI, ML, generative AI is a superpower, and we can use it to unlock a lot of leverage, particularly for our healthcare providers that are already overworked, suffering from burnout, have a lot of demands on their time. We can leverage these tools to help all of our providers operate at the top of their license, which I think is quite compelling. When you look at the world of AI, and I always like to come into these conversations with frameworks, you can almost imagine an XY graph where on one axis, you've got ease of adoption, and on the other axis, you've got complexity of the technology. And you see a world of generative AI that's already being readily adopted. You think about tools like automating clinical documentation and note-taking has the potential to save doctors 30% of their time right. That's we live in the EMR doing a lot of documentation, and now we have companies like Regard, which is using machine learning and large language models to look at all the unstructured and structured data in the EMR and spin out a clinical note. And then based on the exam, also help with assessment and plans. It's incredible. For the hospitals that are using this technology, it's saving their doctors tons of time, enabling their surgeons to spend more time in the operating room, and their non-surgical providers to spend more time with patients. Mm-hmm. You're seeing a number of use cases in prior authorization. You think of companies like Fairway and Cohelm, which are making it easier both on the provider side, so providers completing prior authorizations on behalf of their patients, but also better and more optimized on the payer side, so that we're able to more expeditiously approve prior authorizations. There's still a lot of manual work that goes into reviewing these and making sure that the patients are well suited for the intervention or therapy that they're trying to get access to. So I just get very excited here, and I start to think about a world where, what if every healthcare provider had a range of superpowers? Whether it is the ability to generate text, evaluate images, explore and optimize towards better diagnostics for patients. It becomes really exciting, and we're right at the infancy here of use cases for generative AI. They're only going to get better and better, particularly as the cost of compute drops at a precipitous rate.
Love that. Graham?
Yeah, no, I echo everything they said. It starts with, for me, like empathy for the people that are essentially forced to deal with the musculoskeletal medicine market while not actually being providers or patients or doctors. There's a lot of people that are faceless that we don't know, that are third-party administrators, payers. Just look at the stats. It's there are $100 billion of money that goes into musculoskeletal claims a year.
Mm-hmm.
And so when we look at the problems that health insurance plans have, there are three pain points. And this applies to workers' comp and non-workers' comp insurance plans. The first is they're all under pressure to be cost effective. They're all trying to find and approve procedures and interventions that actually have clinical value. Because even if you take the most nefarious perspective that they don't necessarily care about the patient, they want the patient to get back so they can go back to work and still be a functional member of society and pay their premiums. That's a stark reality. And third, what most people don't realize is that all these payers have state mandated timelines, 48 to 72 hours, by which they actually have to render a decision on a musculoskeletal claim, whether it's 48 hours or 72 hours. It's a very short window. So they have to have teams that have to provide analytics immediately on any musculoskeletal claim that comes across a desk. And we don't do, even on the physician and provider side, we don't do a great job of it because there's so much data that goes along in a single patient, and so much of the documentation can be very confusing that if you sent a single patient's file to an insurer, that could be anywhere from 50 to 1,000 pages. Mm-hmm. How can any human being who is not medically trained and has a 48 to 72 hour time window to decide authorization or not authorization on a case actually make a rational decision? They can't. So you need AI or some kind of automated process to be able to help leverage that. There's a lot of data out there, and IHA, one of our partners is Figure 8. They're amazing. They collect so much data around a single patient that could almost replace the musculoskeletal physical exam, if not already. And we're proud to partner with them, and we're able to help make sense of all this data that actually results in something that's very meaningful and very easily potable by anyone. And so there needs to be someone to actually go through the noise and filter through it, to empathize with these payers and third-party administrators that are forced as a living to make these critical decisions.